just gotta get out of my head a bit, out of the negative, out of the pessimist posture of doubt where everything's relative and everyone is my nemesis. Yeah, I just gotta get out of my bed again, get back in the game, though I might never win, the fight might never end, and nothing is forever, every day is heaven sent, and everything is better when I'm out of my head, the second I'm stepping out, whenever I look at you, the second I left the house, the scent of the fresh air, the wind that carries us, the feeling will get there. That's when we deal with what's real, can't numb the pain to heal, one must feel the hurt for a season, but it hurts for a reason, done dreaming now, I'm searching for meaning out of my head. Get out of my head a bit, out of the negative, out of the pessimist posture of doubt where everything's relative and everyone is my nemesis. Yeah, I just gotta get out of my bed again, look out my window, see through a better lens, look up to the sky, look up to better men, the brethren are getting together, I'm getting out of my head. Not everyone gets to live, death is definite, the rest ain't guaranteed, life is a gift we get to give, the world is desperate for us, I can't let it get out of my head. I can't see truth, but I can see proof the world's not lost. Whenever I see youth believing in magic, I believe that we have it. See that trick, poof, I'm out of my head. And I'm glad to be alive, glad to see the sky, the sun, I see it rise. The love I keep inside, that's why I need a rhyme. I need to breathe a sigh and let it out. Things are different.
don't give a damn. If the rhymes don't fit, the DJ quit. This song don't give a damn. You can't sing or dance to it, can't romance to it. This song ain't arrogant if you don't try and buy it, or if your radio denies it. Don't care about who got what's cool on TV or what spot's hot, I forgot. I ain't mad at evolution, but I stand for revolution. Get up, enough is enough. Hey, somebody stand up, come on. Get up, stand up. Get up, stand up. Get up, stand up. Get up, stand up.
How many blood diamonds shining in that chain? How much compromise is tied to that fame? How many more times we gotta hear that lame line? I'm inspiring them to do what? Roll better weed and get higher than them. Feed the needy, greedy ass buyer in them. Be the same damn dog with the finer women. They gon' tell me that I'm preaching to the choir and I'm showed it right, but I'm trying to light a fire in them. Cause I was raised by the enemy, and ever since then that's been my identity. So I'm trying to give back what was given me. Truthful delivery is my tendency. Youthful, the spirit up in my energy. Bottom of my feet is something that you'll never see. That's cause I'm standing, singing the anthem. This from my hand, and the list of demands. And when they hear this, might piss in their pants. And try to get the children not to listen to the man, but the mighty PE is what birthed Ali. So what you think gon' come after me? Jump to it.
If you deny, post this song cause I see wrong. Most of my heroes still don't appear on no stamp, so I ran, even when they say I can. I rise against, rage against. Hope I don't end up being the same thing I'm fighting against. Hence, I went, I'm never on the fence since they think the masses are powerless. I ain't on nobody's powerless. I ball my fist with my audience like this. I raise my fist with my audience. Yeah, like this. Get up! Stand up! Get up! Stand up!
Hello everyone, and welcome to Session 3 of the Global Black Feminist Reading Circle. My name is Randie Henderson, and I am one of the Black Feminist Reading Circle members of this online group. This session runs from January 20th until June 2nd and includes 2 week-long breaks. Our democratically selected reading material is Harriet A. Washington's book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. Our book group meets each Tuesday evening from 6:30 to 8 on the Google Plus Hangouts on Air platform. You may find the Global Black Feminist Reader Circle on Google Plus, YouTube, and Facebook, and always feel free to join us in reading our story together.
I'd like to welcome everyone to the Global Black Feminist Reading Circle, Session 3, Tuesday, January the 20th to June the 16th. Our session will be from 6:30 to 8 p.m. I am your moderator today. This is meeting 18, June the 9th, 2015. My name is Joel Jones. I'd like to welcome everyone that's on YouTube, Facebook, the whole 9 yards. Like I said, my name is Joel Jones. I'm the moderator. The co-hosts are Michelle Odom and Randie Henderson. And I would like, at this time, we'd like to introduce all the members of the groups. We'll start from the furthest south and we'll work our way up north.
Oh, Georgia. Okay, that must be me. Okay. I'm Georgette Moses, participating from Columbia, South Carolina. And I'm glad to be here.
Welcome.
Hi, my name is Randie. I'm watching from Atlanta, and if you missed it last week, I'm sure it'll be mentioned at the end of this, but our next book is Parable of the Sawyer by Octavia.
Hi, I'm Kim, and I'm in Brooklyn, and good evening, everybody.
Hello.
Hello, everybody.
And I'm also in Brooklyn, New York. My name's Michelle Odom.
How you doing, Michelle?
I'm good.
Hi, my name is Venita Walker, and I am joining you from Cromwell, Connecticut. Welcome.
Oh, okay. This is the Epilogue here, medical research with Blacks Today.
Harriet Washington has exposed in detail the misuse of Black Americans as the convenient subjects of profitable medical research. They were powerless, maligned, and abused not strictly for scientific knowledge, but to support American cultural beliefs, politics, and economic trends. The social and legal landscape has changed dramatically from the times of slavery, and medical research practices have followed suit. It's safer for African Americans to participate in clinical trials, and necessary. However, we must be informed, vigilant, and actively engaged in the process. We must guard against the erosion of informed consent and the laws that protect us. She warns that colonialism, residual racism, and classism have allowed Western medical researchers to continue their abuse on the vulnerable people in Africa and other non-white colonies and territories. Washington offers some solutions to improve the quality of medical research for African Americans, which would also positively affect other communities. Finally, she outlines challenges that will enable African Americans to not only survive, but hopefully thrive while interacting with the American medical system.
Medical abuse and exploitation is a historical fact and remains an ever-present possibility. Focusing only on African American atrocities without acknowledging past and present abuses will ensure the scientific community never inspires trust. It's not anti-science on the part of the subjects, it's denial on the part of the researchers. American medical research has a history of ethical deficiency. Joyfully embarking upon medical research might seem contradictory, but Washington encourages us to remain wary of potential research abuses. Media exposure of racial research scandals, socio-political changes, greater involvement of Black physicians, researchers, and journalists, and government restrictions on wayward university research programs have improved the climate, creating a limited but real success story. And the question is there an organization in your city that focuses on health disparities? Well, I didn't know, and so I had to look it up. And the University of South Carolina actually has an Institute for Health Disparities. And would you know, let's see, who was it? James E. Clyburn giving lectures there concerning that. Their mission is to eliminate health disparities and promote health equity using a meta-leadership framework that increases academic, community, and other strategic partnerships in South Carolina and beyond. And the other organization I found was Community Health Intervention Program, and they focus mainly on cancer. They give many grants for high-risk populations across the state, of which the population, many of those are African American females. And I had no idea about those two, so I'm glad you asked that question.
Anyone else?
I have a organization here called Project South. They don't really only focus on health disparities. They focus on empowerment through the knowledge of health disparities, and their focus is giving you the education and the rhetoric to know how to uplift your community socially, economically, which both equal out some health disparities. And so they focus mainly on inner city communities, predominantly Black communities, or predominantly POC communities, with and poor communities. So my cousin used to work there.
Anyone else? I have a reason for asking that question. And it kind of goes along with what Venita was saying and everyone else. Michelle?
I don't know, but since I'm in New York City, I'm going to guess that probably several organizations have their national headquarters here, but I need to look into it.
And the reason why I kind of like ask that is that I think we'll find that when we're trying to, close the gap in health disparities, and we're talking about the atrocities and the flow of information, when we're talking about, research and experimentation and things like that, is that there are so few medical doctors that work outside the corporate system now that have their own private practices. So you will find very few doctors who have admitting papers to corporate hospitals because they're freezing them out. That's what we find out. A lot of these doctors work for these huge corporations, and they are just ginning people through. So your information about health becomes very skewed. And like Venita said, when it comes to, insurance companies, the corporate hospital, and the pharmaceuticals, your name and your signature is all they need to get paid. You know what I mean? So things happen to people. And so if you don't have organizations that focus on the information flow, then, we'll be back with square one about different things that happen to us in the community as African Americans. You'd be surprised, even in this particular area right here, you only got 1 or 2 doctors that really close the gap in health disparities, and the rest of them, they don't even look that way, black or white, which I found was kind of amazing.
No, it makes me think about the law profession, where you have a very small number of black lawyers in the first place, and if you if you counted all of them that focus on the public interest, they could barely fill a thimble.
Right.
And it wasn't always like that. I mean, 60s, 70s, even into the 80s, you had a lot more activist kind of attorneys. But, I guess most of them have just decided if you can't beat them, join them.
Yeah, and I think that's the same way. And I believe that the not just the African American doctors I think the Caucasian doctor has been done the same way. If you go to, everyone, if they go to their doctor, you just look at how much time they spend with you. Mm-hmm. You know what I mean? I mean, these cats are pushing through some freaking patients, but I mean, they are. We're talking about 15, 20 an hour. I'm talking about they got them lined up in the room. They got 8 waiting rooms, and they got one doctor, and he's in there for 5 or 10 minutes, and he's gone. And the corporation, he's sending them to specialists. I've seen that. And Venita and, most of us here, we have, several of us here have chronic illnesses, and we see that when we go to our specialists. And so now we're moving into the part, if anyone will have anything to say, the erosion of consent. And I think that's what everyone really sees what's going on now, which is the real future.
Get up! Stand up! Get up! Stand up! Get up! Stand up! Get up! Stand up!
This track ain't asking you a damn thing. Not the brand name, bottle with your champagne. Not where you land your private airplane. How many blood diamonds shining in that chain? How much compromise is tied to that fame? How many more times we gotta hear that line? I'm inspiring them to do what? Roll better weed and get higher than them. Feed the needy, greedy, aspiring them. Be the same damn dog with the finer women. They gon' tell me that I'm preaching to the choir and I'm showed it right, but I'm trying to light a fire in them. Cause I was raised by the enemy and never ever since then, that's been my identity. So I'm trying to give back